Avian influenza, commonly known as bird flu, is a highly contagious viral disease affecting both domestic and wild birds. This disease poses a significant threat to poultry farmers globally due to its high mortality rates and economic losses caused by mass culling and trade restrictions. The virus is known for its rapid spread and ability to mutate, leading to new strains that may pose risks to both birds and humans. As a poultry farmer, understanding the causes, symptoms, prevention, and treatment of avian influenza is crucial to protecting your flock and livelihood. What is avian influenza, bird flu? Avian influenza is an infectious disease caused by influenza A viruses from the Orthomyxoviridae family. These viruses primarily affect birds, but have been known to infect other species, including pigs, cats, and humans, under certain conditions. AI viruses are categorized based on their pathogenicity, severity of disease in poultry. Types of avian bird flu. Number 1. Low pathogenic avian influenza, LPAI. Causes mild symptoms or remains asymptomatic in poultry. Often goes unnoticed as birds may continue eating and laying eggs. Can mutate into a highly pathogenic form under the right conditions. Number 2. Highly pathogenic avian influenza, HPAI. Severe form of the disease, often leading to sudden death in birds. Spreads rapidly within flocks and can result in 90 to 100% mortality. Causes severe respiratory, digestive, and nervous system issues. Requires urgent action, including culling infected birds to prevent spread. AI viruses are further classified into subtypes based on hemagglutinin, H, and neuraminidase, N, proteins such as H5N1, H7N9, and H5N8. These strains have been responsible for major poultry outbreaks worldwide and some human infections. Causes of avian influenza in poultry. AI viruses can spread rapidly due to various transmission methods. Below are the key causes and risk factors. Number 1. Direct contact with infected birds. Healthy birds become infected when they come into contact with infected poultry or wild birds. Migratory birds, ducks, geese, and swans, are natural reservoirs of AI and can spread it across long distances. Number 2. Contaminated surfaces and equipment. AI viruses can survive on feed, water, cages, and farm equipment for hours to days. Farmers unknowingly transmit the virus through contaminated tools, footwear, or hands. Number 3. Airborne transmission. The virus can spread through respiratory secretions, including sneezing and coughing. Dust particles, feathers, and aerosolized virus particles can infect nearby poultry. Number 4. Spread through humans and animals. Farm workers, visitors, and poultry traders can unknowingly introduce AI via contaminated clothing and footwear. Rodents and insects may act as carriers, transferring the virus from infected farms. Number 5. Infected feed and water sources. Contaminated drinking water is a major transmission route, particularly in farms using open water sources, ponds, lakes. Improper feed storage may expose poultry to infected droppings from wild birds. Symptoms of avian influenza in poultry. Recognizing early symptoms is crucial to prevent widespread outbreaks. Symptoms vary depending on whether the strain is LPAI or HPAI. Number 1. Respiratory symptoms. Coughing, sneezing, and nasal discharge. Gasping for air and difficulty breathing. Swollen sinuses and facial edema, swelling around eyes. Number 2. Digestive symptoms. Loss of appetite, weight loss, and extreme lethargy. Greenish or bloody diarrhea. Dehydration due to decreased water intake. Number 3. Nervous system symptoms. Head tremors and convulsions. Torticollis, twisting of the neck. Loss of coordination and paralysis in wings or legs. Number 4. Egg production and physical appearance. Sudden drop in egg production. Soft-shelled or misshapen eggs. Combs and wattles turning purple or blue due to lack of oxygen. Number 5. Sudden death. Infected birds may die suddenly without showing any visible symptoms. HPAI can wipe out entire flocks within 48 hours. How to prevent avian influenza in poultry? Prevention is the most effective way to control AI outbreaks. Here are key biosecurity measures to follow. 1. Strict biosecurity measures. Limit farm visitors and avoid contact with outside birds. Disinfect all equipment before and after use. Use protective clothing, gloves, and foot baths at farm entrances. 2. Proper farm management. Avoid overcrowding to reduce stress and disease transmission. Keep separate poultry housing for different age groups. Provide clean drinking water and quality feed. 3. Vaccination programs. Follow recommended vaccination schedules from veterinary experts. Use approved AI vaccines to boost flock immunity. Maintain record keeping to track vaccinated birds. 4. Rodent and insect control. Seal feed storage units to prevent contamination by rodents. Use pest control measures to eliminate disease-carrying insects. 5. Regular health monitoring. Check birds daily for symptoms of illness. Isolate sick birds immediately to prevent disease spread. Report any unusual poultry deaths to local veterinary authorities. Treatment of avian influenza, bird flu, in poultry. There is no direct treatment for highly pathogenic avian influenza, HPAI. However, supportive care can help birds infected with low pathogenic avian influenza, LPAI. 1. Isolation and quarantine. Separate infected birds from the rest of the flock. Culling may be necessary to prevent further spread. 2. Supportive therapy. Provide electrolytes, vitamins, and probiotics to boost immunity. Ensure adequate hydration and stress-free conditions. 3. Vétérinaire consultation. Always seek professional veterinary advice for disease management. Government disease control programs may assist in outbreak containment. Economic and public health impact of avian influenza. Economic consequences for poultry farmers. 1. Mass culling of birds leads to financial losses. 2. Export restrictions on poultry products reduce profits. 3. Increased costs for biosecurity and disease control. Public health risks. 1. Certain AI strains, H5N1, H7N9, have infected humans, causing severe respiratory illnesses. 2. AI viruses do not spread easily from human to human, but direct contact with infected poultry poses risks. 3. Cooking poultry at high temperatures, above 165 degrees Fahrenheit per 74 degrees Celsius, kills the virus, making it safe for consumption. Final thoughts. Avian influenza is a global concern that can devastate poultry farms if not properly managed. Prevention is the best strategy, and biosecurity remains the most effective defense against outbreaks. Small Blue Diamond, stay informed about AI risks in your region. Small Blue Diamond, follow best farming practices to reduce disease exposure. Small Blue Diamond, consult veterinary professionals to maintain flock health. By implementing strict biosecurity, vaccination programs, and routine health monitoring, poultry farmers can safeguard their birds and business against avian influenza.